Good afternoon, everyone, and welcome to our monthly Geri Echo. My name is Sarah Tomkison, and I'm a licensed social worker and part of our Geri Hub team. I wanted to give a shout out for our sponsorship, which is with the Queen's Medical Center and the UH John A. Burns School of Medicine, Department of Geriatric Medicine. Joining me this afternoon is our interdisciplinary geriatric echo team, and we all are willing to teach and share our collective experience and wisdom with you. So please join me in welcoming the other team members. We have Dr. Reese Oweno, pharmacist, Dr. Lucas Morgan, psychologist, Dr. Courtney Nonokawa, our nurse practitioner, and Chris Vale, our physical therapist. As a reminder, evaluations are required if you want CMEs. The best part now is that you can check on your own CME credits online, and this is managed through the Queen's Medical Center's Continuing Medical Education Office. On the slide, you can see where the website is for you to search for those CMEs. And if you do have questions, we've also included that the contact person would be through cme@queens.org. Again, please be sure to do the evaluations if you want to receive those CMEs. And this is in reference to the physicians, the DOs, the nurse practitioners, RNs, and physician assistants. Again, your comments are very important and useful for us in the planning committee for future programs. We want to emphasize that this ECHO webinar serves as a form of mutual teaching and learning from experts and from each of you there on the front lines. As the ECHO motto goes, all teach, all learn. And in the spirit of aloha, we encourage you to please turn on your cameras to help us build a community of learning. Feel free also to eat your lunch, for good nutrition is a key to healthy lifestyle. Just a review about the format, which consists of a short lecture from our expert presenter, followed by open comments from the Echo Hub team members and you, the participants. We really encourage your questions, even case example discussions. Lastly, we ask that you please keep case discussions HIPAA compliant, and this includes not sharing the patient's name, birthday, address, and so on. We learn best from our patients and our clients. They are our best teachers. It gives me a great pleasure to reintroduce to you our very distinguished speaker, Martha. We had the privilege of Martha speaking to us about Medicare last year. I think it was about last year, right, Martha?
Yes.
She's just amazing. Not only is she the subject matter expert on Medicare, but she has her own syndicated radio show. She's the host of a Medicare conversation with Martha and a millennial. She also is a writer and she's published in the American Radium Society Journal and recently the Lancet Oncology. Besides her involvement with Olelo and Living 808 on K22, Martha is a licensed general agent and financial paraplanner and a qualified professional since 1995. She also conducts quarterly Medicare pre-retirement workshops for several companies and nonprofit groups. Prior to transitioning into the health industry, Martha worked as a trust officer with First Hawaiian Bank, and she's also a former vice president with Morgan Stanley and Dean Winter Reynolds in Manhattan. She is married and has two children, and when she has time, she when she's not sleeping and working, she does enjoy sailing and reading. Welcome again, Martha. We're so honored to have you with us today to talk about things that are changing with the Medicare Part B.
Thank you so much, Sarah, and thank you everyone who put this together. I hope everybody can hear me okay. I'm so grateful to be invited to come back and speak to you again because the information I share is information that I use every day to help people who are exactly the folks that you take care of. So again, I want to welcome and thank you all for attending this session today. The Social Security Administration has implemented key changes to rules and procedures, and they will become effective April 14th. They were supposed to start March 31st, and there was a lot of pushback, so they extended it to April 14th. But these changes will definitely take place, and they definitely will impact how individuals interact with the Social Security Administration. So it's really, really crucial for geriatric providers to understand the updates so that they can best support their patients and the caregivers. This presentation is going to cover those key changes, the impact on the geriatric population, and what providers can do to assist their patients in navigating these changes. I also have a little extra breaking news slide that will talk about an enrollment period under Medicare that is sort of a change was made to that as of April 1st. And I get a lot of questions from providers who want to know, how is my patient getting changed from one Medicare plan to another if it's not the annual enrollment period from January from October 15th to December 7th is out of cycle. So I'm going to talk briefly about the change that will allow agents and brokers to change folks' Medicare Advantage plans under this other little special enrollment period. So just a quick talk about that just real briefly. So if we go to the next slide, it's just my slide that has to let everybody know. Of course, you don't make any decisions based on what I'm sharing today, and you always want to get the most updated information. So sometimes, even on my slides, I don't put certain information because it can change so frequently. So on the next slide, we'll just go ahead and jump right into it. What are some of these key changes that Social Security is making effective April 14th, 2025? Well, the first one is stronger ID verification. The second one is reduction in telephone assistance. And third, a push to online and in-person visits. This is all going to really be, in my opinion, disruptive to the population that's, I'll say 60 plus, because those are the folks I work with. I work with all different age groups, but my 65-year-olds, 75-year-olds, 80, and I even have a 107-year-old person that I work with. These are the rules that will have the greatest impact on that population. So on the next slide, let's talk a little bit about what it means to, all of this push to do everything online. So what that means is you have to go to ssa.gov. So all of this push for online, some people for the first time will be attempting to navigate this stuff. So they'll go to ssa.gov, and this is what they're presented with. So it's a really busy page, but at the upper right-hand side, depending upon where you're sitting, there I circled it a little bit in red. It says sign in. So this is the page a person is presented with if they say, hey, no big deal. They're changing the way things are done. They want to push everybody online. Okay, sure, no problem. Imagine your 65-year-old, 75-year-old, 80-year-old sitting at home attempting to go to this portal and create their ssa.gov account. So they'll need a lot of support from their caregivers, trusted friends, and maybe even providers. Next slide. Then you have to create an account. Now look at this screen. I have a lot of folks that I do sort of a walkthrough with them. Usually we're on the phone and I'll say, hey, pull up ssa.gov and I'll walk you through the system. And the first screen is confusing for them. And then when they get to this screen, same thing. They're like, okay, it says create an account or sign in. Oh, I have an email. Let me sign in. I'm like, nope, you got to create an account first. Then it says sign in with at login.gov or id.me. So a lot of people, in healthcare and in government positions, they're familiar with id.me .me and also login.gov. But to the average person, these are unfamiliar sites to them. But I do help them, walk through and go through this process to create an account. So every time we talk about some next few slides and it says go online, just keep in mind that this is what your loved one or sorry, your patient or the person is going to be experiencing and trying to create an SSA.gov account. Next slide. So, what drove these changes? Well, what we're hearing from the administration, the new Washington, D.C. administration, is they already started with these SSA staff reductions. I didn't hear it directly, but somebody told me they were speaking with someone at the Social Security Administration office, and they were in tears because they found out that their job was being eliminated. So, what has driven the changes? Are the SSA, Social Security Administration staff reductions, a focus on fraud and waste, and also process improvements. And I gotta say, there's something to that because think about it. Social Security has been around since the 30s. Medicare has been around since the mid 60s. So there have not been a lot of process improvements. This is a huge change and it's going to affect us all. Next slide. So who does it apply to? Okay, individuals applying for retirement benefits, survivor benefits, spousal or dependent child benefits, beneficiaries who need to update their direct deposit information, and beneficiaries who receive paper checks and need to change their address. Who's receiving paper checks anymore? I remember when my mom was 90 and I kept, being told that Social Security wanted her to sign up for direct deposit, and she refused. She wanted a paper check. So once a month, I would take her down to the bank, and she got great satisfaction from giving the teller her check and then getting her Social Security payment. But there's a push that they want everybody to get direct deposit. So for those couple of folks who still may be receiving paper checks, if they do need to change their address, this does apply to them. So I would say that is probably just a few people, but anybody applying for retirement, survivor benefits, spousal, that's going to be a large number of people. Next slide. So what is changing? So what is changing is how an address update is reported. So people do change addresses. I get those calls quite a bit. Sometimes people are changing because it's just they can no longer live at home, so they need to go live with an adult child or a foster care situation. So with this population, address changes are common. Also, requests for direct deposit changes. Sometimes a person, maybe there's been fraud on their checking account. A decision is made that we need to just go and close this whole account and give you a new account. Well, if that person is receiving their Social Security payments into that bank account, they need to change it. So requests for direct deposit changes are impacted by this change. Also, the application process for retirement benefits, Medicare, and supplemental social income. Now, I help people all the time who say, Martha, I'm ready to apply for those retirement benefits. What do I do? I point them to Social Security, and sometimes they want to do it online. So they have to go through that process. Also, for Medicare, people have been able to call a phone number, Medicare, Social Security, not Medicare. Remember, when you want to sign up for Medicare, you don't go to Medicare, you go to Social Security. And so some folks have done online applications for that. And supplemental social income, which is different from Social Security. Supplemental social income is an additional income you can receive if your income is lower. So it's really important to understand that these are some of the things that people, again, 60 plus, these are the types of things that they will need to reach out to Social Security to change. What they have been doing is making a phone call and talking to somebody who verifies them. But this is changing because of the focus on fraud and waste. People are going to have to go into the physical location to do that. So next slide. So address changes. So right now, to make an address change, you will need to do it through that My Social Security portal. So keep in mind that first slide that I showed you, if a person does not have an SSA.gov account, they will need to set one up. And that's how they would change their mailing address. If they don't have internet access, they don't know how to do it, they're confused, they will need to visit a Social Security field office. That will be the option for an address change. Next slide. Direct deposit changes. Once again, if you think about that first slide, you must make this change through your My Social Security account or visit a Social Security office. But the good news is they used to take 30 days to change your direct deposit. Now it will be done in 1 day if you do it correctly. So very important to understand that direct deposit, that affects a person's finances, because that's money that a good portion of the population, 65 plus, they live on those Social Security payments. So a direct deposit change is a big deal. And if you can only access it by My Social Security account or by going in person, again, this is going to be a big impact to people who have limited mobility, maybe they're bedridden. I talk about that in another slide, but that's why, even though these seem like, to a lot of folks, it might seem, oh, it's so easy, just go down to the office and make a change, but it's not easy for the population that you work with. Next slide. Okay, so apply for these benefits. Now, you must verify your identity online through what's called digital identity proofing, a digital identity proofing tool. How many people, in those older age groups even know what that means? And even, my son, we do this radio show, Medicare Conversation with Martha, and a millennial, and I'm constantly telling him that the technology is still new even for me, a baby boomer. But he really has been very helpful. And when we do the show, we talk about how folks have to embrace the technology, but we've been talking about it on a voluntary basis. Now, this is going to be required, or you will need to visit that Social Security office to prove your identity in person. Now, again, these changes are taking place April 14th. So if anybody needs to do anything, you might want to call on the phone now, because after April 14th, you're supposed to do a lot of these things through your SSA.gov portal. Now, the exception, a lot of complaints came into, the Centers for Medicare and Medicaid that's responsible for these changes. A lot of pushback came in. So they said, okay, everybody, we're going to make an exception. Anyone applying for Social Security, disability income, Medicare, or supplemental security income, SSI, who is unable to access the portal can still call and speak to someone online. Only issue with that is you still will have to prove your identity. So if you're unable to prove your identity online, still it will require a visit to the office. So it's important to understand that, of course, they're trying to, you know, calm everybody down. They don't want people to think there'll be a line of 500,000 people at the local Social Security office all trying to prove their identity. So again, it's explained that if you're unable to access the portal, there'll be an exception made, but there'll be no exception to proving you are who you say you are. And I'm going to talk about that in the next slide. How do we prove who we are? Well, identity proofing works by reviewing with you your personal information, knowledge-based authentication, document verification, and guess what? I don't know about you folks, but I use as a second authentication, I use my text number. But guess what? They're phasing that out. So that's why, again, this will be so important, because it won't be as easy as putting in your cell phone number and getting that little text and then putting that code into the computer, because they're phasing that out. And again, they'll be using login.gov or ID.me to do this identity proofing. Next slide. So let's think about the things they'll ask for. So most people listening today, you might have no problem sharing your name, your address, your social security number, and your birthday. But a lot of the people that I work with, and some of them are, young, they're in their 60s, of course, they know their name, but even with their address, they'll be like, oh, I can't remember my zip code. Like, what? You got to know your zip code. And then their social security number, I guess they used to remember it, but as they get older, they're mixing up the numbers like, oh, is it 5 6 or is it 6 5? And they're pretty good at remembering their birth date. But if it comes to the birth date of a spouse or if it's a parent, a lot of folks don't remember birth years. They might get the day, the month, and the day correct, but not the years. And I was recently at the where you Department of Motor Vehicles, and I don't know what the problem was, but I kind of overheard a conversation, and the representative behind the little screen was saying, "I need your mother's maiden name, and I need your mother's birth date." So the gentleman could not remember his mother's birth date. He said, "I haven't looked at this for 50 years." He was in his late 70s. He goes, "I can't remember my mother's, maiden name, and I can't remember her birth date." So, how are people going to be able to do this identity proofing over the computer, right? These are folks who probably will have to end up going to a field office because they may not be able to recall this information. So if you have opportunity to talk to caregivers, make sure they understand they need to have this information for their loved ones going forward if they're going to need to interact with Social Security. Next slide. Knowledge-based authentication. This is the one where you must answer security questions. And what happens in this identity proofing tool on the other side, they will look up your credit report. So they will ask you, did you take out a mortgage in 2008? And can you say approximately what the amount was? And also it may ask you for your previous addresses and or phone numbers. How many people, even 30, can remember some of those credit history details? But this is what will be used to authenticate people online so you don't have to physically go into the office. And if you remember it incorrectly, you'll have to end up going to that office because there'll be no way to say, oh, wait a minute, let me keep trying, because at some point it's going to just kick you out. So, very important to know you'll be answering questions about credit history, previous addresses, or phone numbers. So, this is information that people should start gathering now because this is what the process will be. So when they say, "Oh, we'll make an exception and you'll be able to prove who you are," online. Well, if you don't have this information, you won't be able to. And it's so interesting, some of the security questions that we're all familiar with. It'll say, what city were you born in? What is your oldest sibling's middle name? I use that one a lot. What was the first concert you attended? I never use that one. What was the make and model of your first car? I used to use that one. I don't use it anymore. And in uh, what city, what does it say there? What city or town did your parents meet? So think about it. As people get older, they don't remember. So they may have set up, maybe a way to authenticate this way, but they're not going to remember as they get older. So somebody needs to remember all these things because in the future, it looks like they're pushing us to online. So we'll have to know these answers. Next slide.
Martha, may I
Yes.
interrupt and ask you
Oh, sure.
questions?
Oh, sure.
You mentioned they may ask you for your previous address and phone numbers. How far back do they go? I mean, are they talking about when you first got your Social Security card or when you first applied for Social Security benefits on Medicare?
That is a very, very good question. And we don't know exactly how far back they would go, but they would be picking up information from a credit history. So if you have a credit history that goes back 30 years, well, it's a possibility they could. But again, they will be using information based on a credit report. So that's what you can use as your guide.
Thank you.
Okay, so here on the next slide, document verification. Once again, I'm not saying anything about baby boomers. I am a baby boomer. But on document verification, they'll be asking for, can you go back to that slide on document verification? Yeah, so they'll be asking for a government issued ID, a driver's license, or a passport. My passport was expired for like 5 years. I recently did get a new passport, so got that now. But again, when I ask folks who were, in the 70s, 80s, they don't seem to be able to really retrieve this information so easily. Many times they're carrying the documentation like a driver's license, but it's an expired one. Also, something is like your Medicare card. Medicare in 2018, they went from a Medicare ID number based on your social security number to this 11-digit character uh, identification. And many people still present the old Medicare card with the social security number and didn't seem to be aware or never received the new card. So it's very important to understand. The reason I'm bringing all this up is because it would seem like it's so simple because many of us who, are forced, in our jobs, we use technology. We have this stuff, very easy, maybe we have it in an Apple Wallet or something. But when you talk about older folks, it's a possibility they will not have the information to verify their identity. And the point that I'm making is these are the folks that will have to end up, in line at the Social Security office to verify their identity. So green cards, driver's licenses, somebody has to be the caretaker of this because of these changes that start April 14th. Next slide. Okay, understanding the impact of the changes. So in Hawaii, we have 2.5% of the population is aged 85 or older and receive payments from Social Security and have Medicare insurance. So that's why I wanted to talk about this today. I think it's so important to really get an understanding of who these changes impact because, and what I find is that many times people, as they move into those 80s, they don't really feel they have a voice. So we have to give them a voice. And for me, I'm giving them a voice today by letting everybody know that this is going to be a significant impact to this population. And I have 5 or 6 folks I work with. All are over the age of 100. And you heard me say earlier, one of them is 107. So we do have, tens of thousands, maybe about 20,000 people here, 25 that are, over 85, and this will impact them. Next slide. Okay, many have limited mobility or are homebound, making it difficult or impossible to visit a Social Security office. And I cannot tell you how many people on the Big Island have told me that the Social Security office is so far away. It's like a 3 hour, 4 hour round trip with traffic. So it's not only that some people may have limited mobility or maybe homebound, bedridden, but even just to reach the Social Security offices, it's not like they're on every corner. Here on Oahu, we have 2 offices, one in Honolulu and one in Kapolei. So again, this is why it will impact these folks. If you can go back on the slide before I didn't. Okay, so the population of individuals 75 and older also have the lowest rate of internet usage, and some have no access at all. They may live in a property where the other people are using the internet, but not something that they may be accessing. Yet, I know a lot of 75-year-olds that are on Facebook, and they can teach me a thing or two about how they use their internet. But for the most part, this is the population that's being pushed. Remember, why am I talking about this? They're being pushed to go online or physically into an office to prove identity for these very, customary transactions. Many prefer not to use the devices to transact business. They don't feel as safe. They feel like they might be victims of some of the scams they constantly see advertised, especially in AARP magazine. They tell you about all the scams out there, and most feel comfortable using the phone. And as a result of the pandemic, many of the Social Security offices closed. So for 2 years, people could, transact business over the phone by calling Social Security. So for this to go away, once again, folks are very comfortable, on the phone, not so much doing this online and having to visit an office. Next slide. Geriatric patients may have health issues also that impair their ability to accurately recall personal data or locate documentation required for identity proofing. So definitely those forms to disclose, allow you to Social Security disclose information on another person's behalf. Definitely everybody needs to get that completed for their loved one or anyone that they have responsibility for with healthcare stuff, Social Security and Medicare. Just get that thing signed up, whether you need it or not, because if you do need it, it'll be a lot easier. I know a lot of folks I talk to, they'll say, "Oh, I'll get my mom on the phone to say it's okay for Social Security to talk to me." But what if your loved one cannot? And I am finding that a lot of people are finding that their parent, as they get older, or auntie, uncle, grandparents, sometimes they lose the ability to speak um, uh, uh, clearly or loudly enough for someone over the phone to hear. I had that recently where somebody, put their mom on the phone and she spoke in a whisper. And so her adult daughter could understand her, but trying to talk to Social Security over the phone, it just was not working. So we did have to get the authorization first that had to be sent over to Social Security. And then the adult child was able to speak on her mother's behalf because her mother's voice was at a whisper. Even today, I'm losing my voice because I talk so much. So sometimes the voice is just not there for good communication over the telephone. Next slide.
Hi, Martha. Can I
Oh,
pause you for a second
oh,
there?
sure, sure.
Thanks. So, this topic that you just spoke about is something that's been getting some questions and comments in the chat. And I just wanted to see if anyone who was in there, Mary Nell and Sarah and Renata, any other questions beyond what Martha has shared with us about that issue of representation on the phone or in person, even if you're going into the office or in this field site.
So, this is Jackie. So, sounds like the applying to be a representative payee is important if you want to help your dad or mom. Is that available online, or do you have to go down to the Social Security office to apply?
Right. So, just to, restate, so sounds like becoming a representative payee for a mom or dad is important. Well, the kind of disclosure I'm talking about is not as a rep payee.
Okay.
It would be just to disclose information to be able to discuss their benefits with them
Okay.
or update direct deposit. So the representative payee involves actually collecting the money and then doing the reporting that Social Security requires. And that's a whole, kind of another process. But for this, it's getting disclosure to authorize. Now, I was going to um, include the form, but Social Security has told me to always encourage people to call them directly and find out what form they want and don't just share the form. So I'm being very compliant with what they asked me to do. But there is a form that Social Security, you can fill it out online or you can get a paper form, and it would allow them to disclose information about another party. So you would be able to handle this for
In reference to Renata's question about people that are hospitalized, oftentimes they're so sick they really aren't thinking clearly. For a number of reasons. In the past, the social workers were able to sit at the bedside, call Social Security office, and have the patient, as to the best of their ability, verbalize to the Social Security representative. They give permission. I give you permission to talk to my social worker, Sarah. Is that still acceptable
Well, that's a
as
very
in the
good
old days?
question. That's a very good question, and that was a point I wanted to speak to. So I have had those situations, and Social Security is they I can't tell you what's going to happen after April 14th, okay? But prior to that, yes, even now, if you're at the bedside and the person tells the Social Security rep, you can talk to this other person, they will accept that. They'll ask for the person's name and they will allow that. But April 14th, if we know that they have reduced the staff of the Social Security Administration, how easy will it be to actually reach someone on the phone, right? And when you do reach them, they may say, I want you to try to go online and do this transaction, whatever it might be, first. And if you cannot, then I'll go ahead and talk to you. And I will share that I did have that experience just recently with someone, and it's not the 14th yet. And it was something that I know can be taken care of. But they actually said to the person, oh, hey, you need to go to your Social Security account and you'll be able to find that information on your portal. So the person tried, she said, oh, my username's not working. Oh, I can't get this password to work. So after about 10 minutes, the person said, okay, I will give you the information, but you need to figure out how to log in to your My Social Security account because basically that is the future. Any information that is available to you, Social Security will be expecting you to retrieve it on your own through the portal.
Yeah, I just want to affirm what you're saying because we have a situation with my father where we tried to call on the phone to
Mhm.
change the address for he was just moving from one apartment in the assisted living to another. It took like 20, 25 minutes so people probably know this in the group. I'm preaching to the choir. It could take anywhere from 15 to 30 minutes to even get someone to answer the phone because they're so short-staffed. So,
Yes.
we're very empathetic to them. And then we talked to them. It was a problem because my dad does have dementia. So,
Right.
at the end of the day, it took two people to coordinate taking my father down to the Social Security office because they don't do appointments. I didn't know this. They don't do, the old days we used to be able to make an appointment to go
Yes.
into the office. They go, no, sister, you have to go down there and take your dad
Yes.
and bring his identification, and you're going to have to, it's on a first come first serve basis. So my sister and I had to coordinate. I would take my dad because parking's an issue. She would be there at the bus, right there at the stop right by Queen Street and Punch Bowl, retrieve him and physically walk him in to the social, which has like it's very daunting because there's a huge security issue too, right? It takes a while. It's one person at a
That's
time. They have
correct.
to frisk down and
And
make
he
sure you
has
don't have
to,
metals and heavy,
y-
you're not carrying
y-
weapons or anything.
yes, and he has to have ID
Yeah,
because
he had
one
to have
time I
that.
took my mother and she didn't have her ID and I cried because they would not let her in. They made her stay at the security. I had to go in and get something and come back, but they would not allow her in. And I cried, and they said, okay, take this paper, have her sign it, and bring it back. So I have been to tears with this, and that's why I feel it's such an important subject. And if anybody wants to Google Social Security Form SSA 1696, SSA 1696, and that is the form that folks have been able to use to be able to speak on behalf of parent. But please call Social Security first and get that directly from them if that would work in your particular case. But I believe it's better to be prepared than to go in and find out you won't be able to get these things done. And remember, April 14th, we don't know, but they'll say, we told you it was changing. So April 14th is what I really want everybody to put on the calendar. Things may change and you may not get someone to respond the way they did prior to April 14th. They may push you to do online. If you cannot do it that way, then you'll have to go into the office. And what I will say, Sarah, they are suggesting that you will be able to make an appointment now. So they are saying you can make appointments, but I would say try doing that first. I will never say what you can't do, but
And
they're
it could
saying that they
change, right?
will.
It could change
Yes,
from
they're
week to week.
Exactly. So they're saying now that they will take appointments, but I can't say for sure that they'll do that. But it's important to know about this because, again, it will impact people. And I know everybody's hearing about the funding for organizations that support the elderly. They're saying these could be eliminated. So that's why it's important to understand we don't need these programs eliminated. We need more of these programs because of this push to online. Okay, next slide. I'm almost done. I'm just about out of my time. Next slide. Okay, so what can providers do? Be aware. That's the purpose of my talk today, to teach you what's coming and really make you aware. So when somebody comes in and they say, oh, she's not getting money, she's having distress because her finances are all a mess. Just be aware of what's going on, and you know, we'll have to figure out a way to be able to prove people because that's what they'll be looking for. Next slide. Uh, Encourage family members, caregivers to contact Social Security to complete that authorization form to be able to speak on another person's behalf. It's very important to make that call because some people tell me, oh, I have health power of attorney. Social Security does not accept what your paperwork. They want it on their own paperwork. So that's why you really should call Social Security to make sure you know what they want so you could speak on that loved one's behalf. Next slide. Uh, Understand the changes could disrupt Social Security payments and even health insurance. What do I mean by that? I do get calls from social workers at Queen's Hospital, and they tell me, Martha, somebody's here and, they were working, they lost their job, they lost their insurance, they never got Medicare. So I'm like, oh boy, okay, we got to get them Medicare because they have a diagnosis that they need some serious treatment that comes under Medicare when the employer plan goes away. So I've had to sometimes send somebody down there to get the person to fill out forms and fax them over to the Social Security office. And then we were successful with getting them their Medicare Part B. But making a phone call to say, oh, this is the situation this person fell into. If we don't get the B, we can't schedule them for radiation. They will perish. It doesn't hold any water. The only thing that holds water is knowing the rules, getting the paperwork, and getting it to Social Security. So very important just again to understand this. Next slide. Okay, so before I talk about this Medicare enrollment change, I just want to give everybody listening two phone numbers for Social Security. Um, in case you don't have them, there's a national toll-free number for Social Security, and that's the 1-800-772-1213. That's 1-800-772-1213. That's the number. If you Google it, what's the number to call? That's the call center for Social Security National. But come on, we need to talk to somebody here. So if your loved one or your patient is closest to Honolulu, I'm going to give you the number for the local Honolulu Social Security office. It's 1-855-572-4879. 855-572-4879. And the number for Kapolei is 1-855-572-4866. That's 1-855-572-4866 for Kapolei. Now I have all the numbers for Big Island, Kauai, Maui. I have numbers for New Jersey, Arizona, Los Angeles. I have numbers for all over the country, but it's useful to be able to get directly into the office closest to where the beneficiary lives, and you tend to get shorter hold times that way. So if anybody needs that, Sarah, Justin can reach out to me, tell me what zip code you need it for, and I'll send it to you. So with that, the last thing I want to cover is something called Medicare enrollment period. And this is a change to April 1st, 2025. This is a change to what's called the Disaster Emergency SEP. This is a special enrollment period for people who have Medicare Advantage plans. Medicare Advantage plans. Normally, they can only change plans from October 15th till December 7th, and those changes would become effective January 1st of the following year. That's the normal annual enrollment period. There's other enrollment periods, but that's that one. Also, there's something called an open enrollment period. I talked about that last time. That runs from January 1st to March 31st, only for Medicare Advantage folks, not people who just have a drug plan, but Medicare Advantage plan beneficiaries can change between January to February till March 31st, and they'll have an effective date the first of the month following when they put in the application. But there's this other enrollment period that's been around. It's called Disaster Emergency Special Enrollment Period, designated for beneficiaries who've been affected by local, state, or federal state of emergency. Think about the Maui fires, okay? Folks who, you know, had a reason to enroll and couldn't because of that, they get this special enrollment due to a disaster. Now, we were told for the last few months, we were told that this was going to be eliminated. And if somebody wanted to enroll under this disaster special enrollment period, they had to call 1-800-Medicare. This was reversed about a week ago, and it's not going to take place. It was supposed to take place April 1st. It's not going to take place. So agents can now enroll a person using this disaster. So any place like, our state, we've had a couple of, emergencies. So if you find that somebody, I think we have one more slide. If you find, oh, this is this, oh, next slide. I can't tell which, yeah. Okay, so yeah. So yeah. So anyway, so Centers for Medicare and Medicaid had said that only Medicare would be able to make these changes. It was supposed to happen April 1st, but they reversed it. They retracted this. So agents now can continue to enroll people in a Medicare Advantage plan anytime. All they got to do is say, oh, it was an SEP for disaster. So very important to understand that if your patient's insurance change and you're thinking, wait a minute, it's not the annual enrollment period, October to December 7th, which usually takes place January. How could they change? People's plans are being changed under this SEP disaster. The reason that I say that is because I get a couple of calls every month, and somebody's saying, I don't know how my loved one's, insurance got changed because we're not in the open enrollment period, the annual open enrollment. Well, this is another enrollment period for Medicare Advantage beneficiaries. So if somebody gets a hold of that person, maybe they call them and they answer the phone, nobody's watching them, they could give their information, they could be changed, and they would have a new plan, which many times can cause issues because that doctor, may not be on that plan, the benefits work differently, and then the loved ones have no idea what happened. So I just wanted to bring it up that there are people who can have their plans changed if they uh, go under this SEP for disaster. And yes, thank you, Lori. SHIP does have those phone numbers. If somebody said I gave too many numbers, but SHIP does give those numbers. So thank you so much for posting that because I meant to include it on my slide and I didn't. So that's why I wanted to give those Oahu numbers, but they have numbers for Maui and Kauai as well. So I think that I think I have another slide that just says mahalo and lists the number for Medicare and the national Social Security number. But that ends my presentation for today. So if there's any questions, I'm happy to answer them.
Martha, big mahalo to you. And I feel like every sentence that you give us is like a piece of gold.
Oh,
And I wish you could keep
thank you.
talking for a long time and
Thank
somehow
you.
have it transcribed for us. So yeah, now we can kind of turn it over to the group and see if any of our panelists first have any thoughts or comments or questions for Martha. Sarah, anything from you in sort of the social work realm?
Yes. So before the social realm, I would like Martha if she could kindly give her phone number and her new address that maybe Justin can enter into the chat because I didn't see it on the slides, Martha.
Yes, I would be happy to. People can reach me. I give out my personal cell number. It's 808-230-3379. That's 808-230-3379. And we just moved into a new office at Restaurant Row that's down at 500 Ala Moana Boulevard, Honolulu, 96813 now. We're on the ground floor level, right between Ruth Chris Steakhouse and the Row Bar. So, so that's a good location. But there's also physical therapy is close by, Straub ear, nose, and throat, diagnostic labs, and CVS specialty pharmacy. So we're right there, and it's no longer going to be Restaurant Row; it'll be Medical Row, and I'm right in the middle.
And there's
What
parking available.
Yes, there's parking available. Yes.
what
May I
email
ask a
address would be
question?
best to reach you at? Sorry.
Sorry.
Which email would be best to reach you at, Martha?
Oh, the email is Martha@get2insurance.com.
Okay,
Get the
thank
number
you.
two insurance.com.
Thank
May
you.
I ask a question?
Sure.
Earlier, you mentioned that you have access to local Social Security office numbers, even you can even search by state. Is that information available to the public
Uh,
online or something?
Um, it should be available to the public online, but what I find is I've gone to the site and it just keeps showing the national number. So because I work with people in different states and they often get letters from their local Social Security office that they want me to evaluate for them, so then I just keep track of that phone number.
Or
So yeah, I agree. It can be pretty overwhelming, right, Lucas? But every I am Social Security eligible. So I want people to know it took 4 months for them to process. I started this in December 1st, and I just got a letter saying that I'm eligible and approved. It didn't say when, it didn't say how much money or any, it says it has a prospective amount that you get. But did you have to pay taxes? Some of us have to pay taxes on Social Security depending on your tax bracket. But
That's
without,
right.
yep, without digressing, I'm here on my website, and you were talking about the authentication process that they probably are going to phase out the SMS texting. And I'm
Yes.
just baffled because they keep listing more authentication methods. There's like
Yes.
five. So for everybody out here, that's text messaging, there's automated phone calls. I tried the face or touch unlock. That did
Yes.
not work because I don't have, I have to take a picture of the QR code, which is on my phone. There's fingerprinting to access your social security account. And the best part is, are they going to keep offering backup codes? So backup codes, they give you a whole list of numbers for
Yes.
that I don't know where you're going to store all these ukumia
Me
numbers.
either. I that's that Microsoft Authenticator, and I
Yes.
cannot. I will confess to everyone listening, I have not been able to use that. I use the SMS text messaging, and I encourage everybody to do it. And when I saw that it was going to be phased out, I was like, no, I don't ever want to use that Microsoft
Yeah.
Authenticator.
Yeah.
My son knows how to use it, so that's why it's really good. I work with a millennial every single day. So I'm able to get through. But again, I cannot imagine people who will be trying to help people with this process. I can't imagine. Yeah.
Yeah, yeah, yeah. Because I think sometimes it's on another application, dual mobile, as opposed to most of us may have the VIP access. But you have to switch for an older adult, you have to switch back and forth, right? You have to be able to, if you see, like you have the desktop open and you got to go and find on your iPhone where these codes
Yes.
are, and you got to tap
Yes.
on back on the desktop, and
Yes.
then next thing you know, you're kicked off. the website
Oh, yes.
because you
And if
took
you
too long.
or if you put in the wrong information 3 times,
Three
like, oh,
times, yeah.
sorry, come back in 24 hours. So I've done this process with many people, and I enjoy it because we start laughing and making fun of it. And I know if we weren't together, the person would be pulling their hair out. But I make it like I really say, let's have fun with this, and we just laugh, and we end up getting it done, and it was fun. So I love
The
helping.
only question I have for you, and you
Sure.
may just to see what your insights are. I didn't realize that there's certain times that Social Security is
It's
available online.
closed.
I thought that you could do it 24/7. Do you see anything happening
No.
in the future?
Right. So I know Medicare is still 24/7, and I'm wondering if Social Security, as they restrict the phones, I don't think it's going to be available 24 because that's the whole part. That's the whole point. They want to push people away from calling. So I think it's going to be getting back to online because I'm sorry, the Social Security is not always available online. Yes, I think they will move that part 24 hours. Yes, I don't know for sure, but I think by telling everybody they have to go online, I think it's a possibility they will open that up because right now it closes at like 2 a.m. New York time or something, like 11 our time or something. But I think at some point they may increase that, but it all depends on the pushback. So I think people will have to see how this thing goes April 14th, and they will need to reach out to, their congressperson and say, hey, this is a problem. Can you expand the Social Security online hours so we can reach the SSA portal online 24/7? But you're absolutely correct, Sarah. Right now, I've been on at like 11 o'clock at night. Like, what do you, it tells you in 20 minutes, you will no longer be able to complete this application.
Well, thanks, Sarah and Martha, for all of that. And in the interest of time, I'm just watching the minutes go by. Unfortunately, sadly, just want to orient folks to the chat where you can find the Echo evaluation link if you're looking for CME credits. And really big mahalo to the geriatric Echo support staff, Justin, John, everybody else. And in the last couple minutes, not enough time to go through the panel, but anyone from the panel, anyone from the audience or attendees here today, any last questions? And I have a question.
Oh, sure.
um, so in the psychology world, in my circles, we're like passing around advocacy, sort of petition signing to sort of do the pushback from our angles. What, in your opinion, is the most effective or useful forms of advocacy that we could participate in to support this?
Well, from what forms of advocacy, I've had a lot of success actually reaching out to our Congress people like Mazie Hirono, calling the office and telling them that for your population of patients, this is just not going to work. And if this is something that has to happen, they're going to have to create advocates to help walk, folks through the process of how to identity proof and do this online. So phone calls have, been something I've seen work, or a letter to the Congress folks.
Okay, thank you very much. That's useful. So a direct communication from us as a individual person, provider, and that might be something they pay attention to.
Yes.
Um, Thank you. And thanks, Justin, for posting the link to download the slides. I definitely just did. So really, really helpful. Well, in the last couple minutes, thank you so much, Martha, for being with us again. And anytime you can come back, maybe we should do another one kind of right after the 14th. And then you can help walk us through who knows what kind of gobbledygook might be going on.
I would love to. Yeah.
Yeah.
The fall would be
Okay.
good.
Yeah, the fall is fine. Yeah. Like give us a few months to see how it goes. It's very, if this will be impactful and if anybody runs into a brick wall, please don't hesitate to reach out to me because I work with folks dealing with Social Security and Medicare every single day. And even though, we have an agency that my son runs, I focus on all of this, the problems. So that's what I do. I'm not selling anything. I'm just trying to help my community because I love the people of Hawaii. I love your organization and what you're doing. And if I can be a partner with you to help you, if anybody hits the wall, I'm here. And I work with the Queens Hospital social workers. They call me every week and we're able to fix a problem that seemed unfixable. So I'm your Medicare buddy.
So valuable and so inspiring for me to know that someone like you is out there with that kind of passion and aloha. So mahalo to you again and everybody else for joining us
Thank you,
today.
Martha.
Thank you,
Awesome.
everyone. You're the best.
Aloha, everyone. We'll see you next month.